Hello, everyone. Welcome back to our YouTube channel where we look at the most interesting mental health issues that affect our body, our mind, and then our well being. Today, we are about to look at one of the most interesting topic in mental health. Are there times that you hear voices? Are there times that you see things that is peculiar to you that others do not see? Are there times that you feel things that are peculiar to only your senses alone, that others are not feeling same? This is the issue of psychosis that we'll be dealing with today. And joining me today in this on this episode is a lecturer, a clinical psychologist at the Department of Education and Psychology at the University of Cape Coast. Doc, you're welcome to this episode.
Thank you for having me.
Okay, so Doc, we want to talk about one of the most, trending issues in mental health, that is psychosis. Most of the time, people tend to see things only peculiar to them. They hear things only peculiar to them. They feel this, they have all senses, responding to things that they can only explain, whilst others around them cannot really feel, hear, see, or even touch or something. So this is the issue of psychosis. So Doc, from you, what actually is psychosis? What is psychosis? When you talk about psychosis, what is it?
So, thank you very much for this question. We talk about psychosis. We are talking about mental health condition where people have lost their sense of touch with reality.
Okay.
Which means that the way we see reality, they can see it that way. Or the way you can see someone standing, someone walking by, they don't see it that way. Their view of reality is distorted. So they can hallucinate where they hear voices speaking to them or where they see things that nobody else can see. So they can see a giant person here right now, and everyone here cannot attest to this part. They can tell you someone is talking to them. I once saw someone who was psychotic at a clinic, and the person said he can see 10 virgins on top of the wall.
Wow.
And all of us in the hospital with this person, we can see those virgins walking on top of the, but for him, he can see
it.
Right? So it's a question of the brain is messing up with the person.
Okay.
The brain is giving distorted information.
Wow.
So the way we see reality, those people who are psychotic, they don't see that reality in the same way. Right? That's why they will tell you, I can see something that nobody else can see. I can hear voices talking to me, and nobody else can attest to the fact that someone is talking to them. When we see the symptoms, we are talking about psychosis.
Wow, psychosis. So seeing things that is peculiar to you alone that others cannot see. But
Right.
look, it's a bit, dicey and very, very, something that we need to have much of a concern to, because me seeing things that is really known to me makes me a weird person among the normal population or the normal society. So Doc, we want to really understand, there are people how they having families, with such people. Maybe they are not aware that this child or this their ward is suffering from psychosis. Can you enlighten us what actually is the cause of psychosis?
So many causes of psychosis. So many. One of them is a mental condition we call schizophrenia. Schizophrenia
Okay.
is a mental health condition which can lead to psychosis. One of the symptoms of it is psychosis.
Wow.
And quite often is because of the fact that a neurotransmitter like dopamine also is disrupted. There's too much of it, there's so less of it in the body. And that is why the person is feeling sick with schizophrenia. And when they are suffering from schizophrenia, psychosis is present almost always. That is just one cause of psychosis. There are many other causes of psychosis. For example, excessive alcohol intake, or something we call alcohol-induced psychosis. So the alcohol that people have been buying with their money, taking for loads of years, over time can impair the brain and lead to psychosis.
Wow.
Because when alcohol impairs your brain is going to give you all these faulty messages. The same with cigarette smoking or smoking of any other substances. Smoking also impacts on the brain, and taking for longer years to a long time, the big thing about smoking and excessive alcohol intake is that the effect of it on the brain is not seen right now. It's seen in the future. So as you do it a lifetime, over time, when it gets to you, right, that is when it impairs the brain, and your brain will start messing with you, telling you that there's something here when there isn't.
Wow.
Telling you that someone is talking to you when there's nobody actually talking to you.
Interesting.
Right? So these are some of the major causes of psychosis. We talk about mental health conditions like depression. When people are going through severe depression, so we have depression-induced psychosis too, it can't get to the level that they will become psychotic, that they will start talking to someone in front of them as if there's someone when there's nobody in front of them. So depression is also one of the major causes of psychosis. Of course, when people get depressed, there are lots of studies that is saying that depression can impact the brain. And when it impacts the brain, it can lead to psychosis. What about stress? When people are also experiencing, severe stress in their lives, it's also shown to deal with the brain or impact the brain or have a negative effect on the brain. And when the brain is impacted, there's also the possibility that it would lead to psychosis. What about anxiety? High levels of anxiety in a person can also disturb the brain and therefore lead to psychosis. So these are mood disorders leading to psychosis, like depression, anxiety, stress.
Okay.
Talk about schizophrenia. Also talk about head injuries. There are people who are falling from the top of a bike, or they had an accident, their head hit somewhere, they had a bit of injury. Quite often people will not be serious with that, they will leave it.
Yeah.
Such head injury can also lead a person into psychosis.
Wow.
Right? So the cause of psychosis are quite a lot. What about childhood traumatic experiences? There are many people who were traumatized when they were children, whether they were sexually abused, whether they were being beaten, whether they were being verbally abused, and so on and so forth. All this childhood traumatic experience can lead to later life, effect of psychosis.
Wow.
So traumatic experiences that people suffered in their childhood can also lead to psychosis because, of course, when trauma is very severe, it also impacts the brain. And when the brain is impacted to a large extent, it can make a person become psychotic and therefore say that I can see things, but nobody is seeing what they are saying.
Yeah.
I can hear someone talking to me, but nobody is hearing what anyone is saying to them. And that is some of the causes of psychosis.
Wow. So, Doc, based on what you are saying, that means that psychosis is caused not only by environmental factors alone. We have the biological, we have the psychological, and we also have the social factors, right? So, Doc, let's look at this. There are at times in our culture, or let me say in the global culture, there are a lot of memes that surround psychosis.
Right.
Especially when it comes to spirituality issues, that psychosis is a spiritual illness. What is your take?
Well, of course, people who belong to the spiritual philosophy, of course, they also have their explanations to why psychosis can be as a result of spiritual causation and attributed to many spiritual witchcraft and all of that. Of course, that is their field, and they can definitely substantiate it when you get close to them. They'll show you reasons why they are thinking that it can be spiritual. So I don't really dispute people when they say that something can be spiritual. Of course, we live in a spiritual world, of course. We go to church because we believe that spirituality and so on and so. When people say that they believe that it can have a spiritual causation, yes, I think that they have a say, of course. Science cannot explain everything. And if you understand medicine, you get to know that the beginning explanations of diseases, earlier times, they thought of spiritual causation of diseases. So when they say spirituality can be the basis, they have a point for sure. But for some of us who went to school and then we've been taught the science, we would argue and say that, okay, these are other causes of it. Of course, we also justify it. And I think that even now we are talking about spiritual healing, inculcating spirituality, religiosity into healing of mental condition. So we cannot discount it entirely and say that the spirituality doesn't matter when it comes to psychosis.
Wow. So, Doc, do we have any, do we hear, or are there any trending memes that surround psychosis to your point of view?
Well, any trends on psychosis? What about you look at the church situation, of course. Many people will say that now we go to church, there are people, they call them, this person is a seer. This person is a hearer or whatever. They see, they hear. that is within the church domain. If you bring it to mental health people, they will tell you that you are becoming psychotic, that you can see something, nobody can see it with you. You can hear something, nobody can hear. They will say that you are being psychotic.
Okay.
But of course, we can't say that they are psychotic.
Exactly.
It's just that they are practicing their religion, of course, and you can't put psychosis on that. We are talking about when it gets to the degree that people see that this is disturbing to me. I'm always hearing people talking to me, and the talk that comes doesn't really make sense. It's not something we can make anything out of, right? You are hearing things, you are seeing things which don't really make sense. And it gets to the point that we see that this is really making the person's view of reality get distorted. So it's difficult to communicate with these people.
Yeah.
Because once you are talking to them, they are hearing other voice talking to them. Once you are trying to speak to them, you want them to see you or look at something, they'll be looking at you because they've seen something. That this means that it's really disrupting the daily activities of the person.
Okay.
That is when we can really get psychosis. But if you go to a church situation and then people are saying, I see, I hear, of course, after that religious practice, they're able to live their lives. They go to where they do everything, so we can't put psychosis on that one.
Wow. So basically, that means that you can hear, you can see, but if it is not affecting your daily functional life, wow, that's very interesting, Doc. So, Doc, let's look at the intervention for an individual going through psychosis. There are people out there who might be having, their word, as I said, with psychotic symptoms. As a clinical psychologist who has practiced for so long, what are some of the interventions that are being kept in place to help individuals with psychosis?
Well, so talking about intervention for psychosis, of course, medication.
Okay.
Psychiatrists would always want to give medications to help bring the symptoms down. So medications can be one of the ways of dealing with psychosis. The other thing can be cognitive behavioral therapy.
Okay.
What cognitive behavioral therapy does is to help you deal with depression, anxiety, stress,
Okay.
which can actually be one of the major causes for psychosis when they are in their severe forms. So going for intervention or going to the clinic, you meet a clinical psychologist, they will take you to cognitive behavioral therapy to work on your thought, to work on your behaviors, work on your emotions, and then that will make sure that you can deal with depression, anxiety, stress, and therefore they cannot get to a level that they can impair your brain and therefore lead to psychosis, right? So that is just about it. Sometimes you need a combination of the two, both medication and then therapy, which is cognitive behavioral therapy, to help you be able to get out of psychosis, right?
Yeah.
But on the personal level, what you can do to prevent psychosis or reduce your symptoms of psychosis, cut down on excessive alcohol intake.
Okay.
Stop smoking cigarette or any other substance that you smoke, because these guys will impair the brain.
Wow.
And therefore you use your money to buy them and they'll come and impair your brain and you become psychotic. Now you have to be on drugs for psychosis, right? So smoking, excessive drinking of alcohol, all these things have to be cut out if you don't want psychosis to disturb you. Of course, and so many other things that can be done on a personal level. Dealing with depression, dealing with anxiety. If your person is suffering from schizophrenia, of course, getting medical attention for it, and so many other things that can be done.
Wow, Doc, I want you to just highlight just a brief intervention that families with individuals suffering from psychosis could actually do to manage their symptoms. What are some of the strategies they can cope or they can adopt to help handle individuals with psychosis in the family?
Family-wise,
Yes.
the family cannot handle psychosis by themselves, of course. So if any member of a family is experiencing psychotic symptoms, we've described what it is.
Okay.
They are hallucinating, they are hearing voices, they are seeing things, and it doesn't really make sense. And it's got to the point that the person cannot even function socially. They cannot communicate with them. You cannot plan with them or anything. So they are becoming very psychotic. That is a person you want to send to the hospital and seek medical attention for. Of course, when they go, they meet clinical health psychologists. They meet psychiatrists who can also give medication. Clinical psychologists will give cognitive behavioral therapy. So these ways are some of the ways that you can get help for your relative or a relative that is experiencing psychosis. You cannot do it all by yourself. What you can do to help a family member, for example, if their psychosis was based on alcohol-induced psychosis because they've been taking excessive alcohol for a long time in their life, is to help them by checking them so that they don't take alcohol whilst they are home. and also checking them so that they don't go on smoking, right?
Yeah.
Good. These are things you can do as a family to help the person and cut down on alcohol and smoking, and therefore they will not become too psychotic for sure.
Wow. Wow. That's a very interesting and educative session on this episode. And this episode, we've been looking at psychosis. You hear things peculiar to yourself, you see things peculiar to yourself. Doc is trying to convey that we need to be mindful about our lifestyle. Alcohol intake, cut it. Cigarettes, cut it. Any kind of thing that induce you to stress could be a predictive, or let me say a predisposed factor to psychosis. So, Doc, your last word to our viewers.
My last words is that looking at the lifestyle aspect of it, the things that we buy with our money, the alcohol, the smoking, all this kind of stuff are things that we can prevent. So all the preventive strategies that I've mentioned, they should abide, and therefore psychosis will run away from us for sure.
Wow. Thank you so much for joining us, and we'll come your way in the next episode. Don't forget to like, to subscribe, and to comment on our video. Thank you for watching us.